I am at least 18 years old and I consent to being videotaped for the head to toe assessment. Come in.
I'm going to close the door for privacy. I'm Mackenzie. I'm going to be your nurse today. I'm just here to do a quick head to toe assessment. It's going to take about 20 to 30 minutes. We usually just do these to obtain baselines and develop a plan of care. Can you tell me your name and date of birth?
Sure, it's Mark, 12/29 of 69.
Okay. Do you have any allergies?
No.
Okay, and on a scale of 0 to 10, with 0 being no pain at all, do you have any pain today?
No, 0.
Okay. Now I'm going to assess your vital signs. I'm going to take your temperature. Okay, so it's 98.6. And I'm going to assess your pulse here. Okay, so I got 80 beats per minute with a regular rate and rhythm. I'm going to assess your blood pressure. Is it okay if I use your left arm?
Yes.
Okay, so I got 120 over 80. I'm also gonna assess your respiratory rate real quick. So just breathe normally for me. Okay, so I got 18. It seems that you're not using any accessory muscles and it's unlabored. I would also assess the pulse oximetry, which you would look for 99% on room air, just with the clamp on the finger. Next, I'm going to just look at his physical appearance. He appears to be his stated age. His skin color and tone are even, and pigmentation is appropriate for genetic background. Facial features are symmetrical with any movements and talking. There seems to be no signs of acute distress, and there's no visible devices or equipment being used. As far as body structure, his height and weight are appropriate for his age as well as genetics and body build. The diet he follows is appropriate and adequate. Body parts seem symmetrical. When entering the office, the person stood comfortably erect for their age, and they're sitting comfortably with their arms at their sides now. I also noticed when they arrived that their gait was coordinated and smooth, and there's no involuntary movements and no obvious physical deformities. I'm also going to assess your level of consciousness, so I'm just going to ask a couple questions. Can you tell me your name?
Mark?
Okay, and do you know where you are?
Yes, I'm at the clinic.
Okay, and do you know what day and what time it is?
It's Thursday at 3 o'clock.
Okay, and do you know why you're here?
For a checkup.
Okay, so I would say he's alert and oriented times 4. Then I would assess his behavior. So I would note that he maintains appropriate eye contact, as well as appropriate facial expressions for the situation he's in. He seems comfortable, he's being cooperative and pleasant. His speech is clear and articulate. He appears to be well groomed and clean, and his clothes are appropriate for the situation as well as the weather. So now I'm going to assess your skin and your nails. Just observing the skin color is consistent and pigmentation is even throughout the body. I don't notice any lesions or wounds or rashes. I did notice he has a tattoo on his forearm and his inner bicep on the right side. I'm going to look at your nails now. So they are slightly rounded. They have a pink pigmentation. No clubbing noted, and capillary refill is less than 3 seconds bilaterally. Skin is smooth, warm, and dry. If I assess the turgor, there is elasticity. I don't note any tinting. Now I'm going to look at your head and face. So I'm going to just assess your scalp. If you would look down for me. Okay, so it's normocephalic. I don't see any lesions or infestations. The hair is clear, clean, and shiny, and seems to be evenly distributed. Again, the facial expressions are appropriate to the situation when assessing his face. They're also symmetrical, and all the facial features seem to be proportional. The skin is warm and dry, as well as I don't see any lesions or rashes, and he has no facial tattoos or piercings. So now I'm going to assess your lymph nodes. So I'm going to start, first one is pre-auricular, it's right here. Then we're going to do post-auricular, and then jugulogastric, also known as the tonsillar. And then we have submandibular and submental, and then superficial cervical, posterior cervical, and your deep cervical. And I'm also going to assess the supraclavicular. So I felt no masses or swelling. I would say that there's no lymphadenopathy present when assessing the lymph nodes. I'm going to move on to your neck now. So it appears that your trachea is midline. Your head is positioned midline to your body. That's good. I'm going to just inspect your temporal pulses here, as well as have you turn your head to the right and to the left. So I don't see any visible palpations with the temporal pulses or the carotid pulses. I'm going to assess your carotid pulses here. Your temporal. The pulses don't appear to be bounding. I do feel that they're even and have a regular rate, and they have a force of about 2+ bilaterally. I don't notice any masses on the neck or any swelling with the thyroid gland. I'm also going to assess the range of motion of your neck. So I'm going to have you look to the right and look to the left and look up and look down for me. Okay, so it appears that you have a full range of motion in your neck. I'm going to move on to your eyes now. I'm just going to observe the external part of your eye first. So they are symmetrical in placement. I don't notice any infestations of the eyebrows, eyelids, or eyelashes. That's good. There's no swelling that I notice, so no lesions or anything. The sclera is white. I'm going to just pull down a little bit on your eyes here. Conjunctiva is pink and clear. And then I'm just going to shine this light in your eyes and assess your pupillary reaction, okay? I just want you to look right at my nose. Okay, so pupils are equal, round, and reactive to light, as well as accommodating when the light is shown into them. Now I'm going to assess your ears. I'm just going to look at them externally first. So the ears do seem to be symmetrical. They are placed appropriately and evenly with the outer part of your eye. I don't see I don't notice any piercings on either one of your ears. I don't see any lesions or redness. I'm gonna do the external part of your auditory meatus now. So still don't see any redness or swelling or any discharge. And now I'm going to ask you some questions. Do you have any hearing loss?
No.
Okay. Do you use hearing aids?
No.
Okay. And have you ever been exposed to environmental noise?
No.
Okay. And how do you clean your ears?
In the shower.
Okay. I'm going to assess the skin behind your ears as well. Okay. I don't see any skin breakdown or tenderness. There doesn't appear to be tenderness. Now I'm going to just palpate this little part of your ear called the tragus. Just tell me if you feel any pain or tenderness.
No. No.
Okay, so no tenderness when palpating the tragus. That's good. I'm going to move on to your nose now. It does seem symmetrical on both sides. It's midline to your face, on your face. I don't see any lesions, no redness. Seems proportional to the rest of your facial features. I'm gonna also observe just the internal structures of your nose here. Okay, I don't notice any foreign objects, no lesions or rashes or red areas. The septum is midline, it's not deviated. I also don't notice any discharge, which is good. I'm also going to assess for patency of your nostrils, so I'm going to have you obstruct one nostril with your finger. Just breathe in and then breathe out. Okay, and then just repeat that on the other side. Okay, so there's patency of both nostrils, that's good. Next I'm going to move on to your mouth and throat. I'm going to start with your lips and your tongue and your lips, teeth, and your gums. So I'm just going to have you open your mouth for me. Okay. So I don't see any lesions or cracking. That's good. It's pink and moist inside. The mouth is placed midline on your face. Next I'm going to observe your oral mucosa. So I'm going to have you stick your tongue out for me. Okay, so tongue protrudes midline. Okay. Buccal mucosa is pink and moist. The palate is pink, moist. I don't observe any lesions and there appears to be no odor. And your teeth are evenly distributed within your mouth. I'm also gonna have you stick your tongue out and say ah.
Ah.
Okay, so uvula rises and falls midline. When assessing the posterior pharyngeal, I don't assess any nasal drip or redness. So now I'm gonna assess your respiratory status. So for this part, I'm going to assess posteriorly, so I'm going to have you stand for me for just a minute. Okay, so the spinal column is midline. I don't see any signs of scoliosis, kyphosis, or lordosis. Generally, you would do this part, you would have the client remove their shirt. We're not going to do that. The skin is intact. I would also assess the AP to traverse diameter ratio, which is normally 1 to 2. Now I'm going to just do a butterfly shape with my hands and have you breathe in and exhale. Okay, so I do notice that there's symmetrical and smooth chest expansion. I'm going to check for tactile fremitus. I'm going to have you say 99.
99.
And again.
99.
Again.
99.
Again.
99.
Again.
99.
Okay, so I do, there are symmetrical vibrations for the tactile fremitus test. When assessing the skin, it is warm and dry to the touch, and I don't feel any masses or tenderness. Oops. Okay, so now I'm just going to auscultate at the bronchial, bronchovesicular, and vesicular sites posteriorly. Just breathe in and out. And again. 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 more time. Okay, so upon auscultation, it seems it's clear to auscultation. I don't hear any adventitious sounds such as wheezes or crackles. Okay, you can go ahead and sit back down. Now I'm going to move to an anterior perspective for the respiratory status. I do notice that the chest is symmetrical. He doesn't appear to be using any accessory muscles. His breathing is unlabored. I'm going to assess your respiratory rate one more time. Okay, so just breathe normally for me. All right, so I got 18 again, that's good. I'm also going to just palpate, just let me know if you have any pain or tenderness, okay? Okay, no tenderness,
No
okay,
pain.
and I also did not palpate any masses. Now I'm going to auscultate again at the bronchial, bronchovesicular, and vesicular sites. And just breathe in and out each time I move it, okay? Okay. Again, it was clear to auscultation. I didn't hear any adventitious sounds in any of the quadrants. So next I'm going to move on to your cardiovascular system. I'm going to start by looking at your jugular veins. So I'm going to have you look to your right and look to your left. Okay. So there's no visible palpations. I don't see any signs of jugular venous distension. Now I'm going to have you turn one more time to your right and again to your left. Okay. As far as the carotid pulses, again, no visible palpitations. There seems to be a smooth contour. And I'm just going to palpate these carotid pulses. So again, there's a 2+ force bilaterally for the carotid pulses. I'm just going to auscultate real quick just to make sure there's no bruit. Okay, so no bruit heard on auscultation. Again, the chest seems symmetrical. There's, I would assess the apical site if the client had the shirt off, and you don't want to see any a visible apical impulse. Next, I'm going to listen for the apical impulse. It's at the fourth or fifth intercostal space on the left mid-clavicular line. I'm going to listen for a full minute. Just breathe normally. Okay, so I got 80 beats per minute with a regular rate and rhythm. Now I'm going to auscultate all 5 points of the heart. I'm going to do it twice, once with the diaphragm of the stethoscope and again with the bell of the stethoscope. Okay, so I'm going to start with the aortic. And S1 and S2 is present. You do hear the lub-dub sound. Next, we're going to go to the pulmonic. Okay, and Erb's point. And the tricuspid. And the mitral. I'm going to do it one more time. Is the aortic and the pulmonic. Erb's point. Tricuspid. And the mitral. Okay, so S1 and S2 were present. I didn't hear any extra sounds, no murmurs. Next, I'm going to assess your radial pulses right here. Okay, so I got 80 beats per minute. They did have a 2+4 bilaterally. Next, we're going to move to your gastrointestinal system. So if you don't mind laying down. Okay, so I would start by inspecting, which normally would be done, everything would be done skin to skin. So I would notice there's slight rounding, they're symmetrical on both sides with the abdomen. There's no visible distension. I don't notice any lesions or scars. There's the umbilicus is midline. Skin is homogeneous with pink undertones, and there appears to be no drainage from the umbilicus. Next, I would auscultate the abdomen. I would start with assessing the abdominal aorta. I noticed that there is no visible pulsation, so I would begin with the auscultation of that. I would use the bell of the stethoscope. Okay, and there's no bruit auscultated. Next, I'm going to move on to auscultating the bowel sounds in all 4 quadrants. I'm looking to hear 5 to 30 sounds per minute. Okay, so bowel sounds were present in all 4 quadrants. Next, I'm just going to do a light palpation of the abdomen. Okay, so I don't notice any muscle guarding. I didn't feel any masses. There's no rigidity or tenderness that I observed. The skin was soft, dry, and warm. Okay, do you want to sit up? Okay. So now I'm going to move on to the musculoskeletal system. So I'm going to assess your range of motion. So what I'm going to have you do is just reach up and then touch your other shoulder, and touch that shoulder, and then reach behind. Okay? I'm going to have you do the same thing with the other hand, and then over, touch the shoulder, and behind. Do you feel any pain or tenderness?
No.
No? Okay. And then normally when you're testing the range of motion, you would also kind of feel as they're moving, make sure that there's no crepitation as well. So now I'm going to assess the size and contour of the joints. So I would inspect them, just observe them. You want them to be symmetrical, as well as have the contour to be uniform throughout. I don't notice any swelling or redness in the joints. There's no visible masses or visible deformities. The skin appears to have pink undertones. Next, I would palpate these joints. So I don't feel any warmth. There didn't appear to be any tenderness. I didn't observe any swelling or feel any masses. Next, I'm going to test muscle strength. So I'm going to have you push forward, okay, and just kind of pull backwards. Okay, and now if you just put your arms like this, pull, push, and then with your wrists, pull, push. And then I'm going to do the same thing on your legs. So go ahead and push, okay, and pull. And then with your ankles, push up, push down. Okay. So I would say muscle strength is 5+, both bilaterally and in the upper and lower extremities. I'm going to assess your dorsalis pedal pulses now, which are on your feet here. So the dorsalis pedal pulses are palpable and have about a 2+ force bilaterally. Next, I'm going to assess your mental status. So I'm going to begin just observing, as I did earlier, that there's an appropriate appearance and behavior, and that he's being cooperative during the assessment. Next, I'm going to have you do a 3-part task. So what I'm going to have you do is just write hello, and then fold the paper and set it back up on the shelf for me. Thank you. And then I'm going to also assess your level of consciousness again. So can you tell me your name?
Mark?
Okay, and do you know where you are?
Yes, I'm at the clinic.
Okay, do you know what day and what time it is?
It's Thursday around 3 o'clock.
Okay, and do you know why you're here?
For a checkup.
Okay, so I would say that he is alert and oriented ×4 again. Now, can you tell me what you had for breakfast this morning?
I had eggs.
Okay, and what town did you grow up in?
In Wooddale.
Okay, so then I would also address that his recent and remote memory are both intact. And can you count backwards from 7?
7, 6, 5, 4, 3, 2, 1.
Okay. And so next we are going to assess your sensory function. So what I'm going to do is I'm going to just use this paper clip, and I'm going to softly just touch different areas, and I just want you, with your eyes closed, to tell me where I'm touching the area, okay?
Mm-hmm. Forehead, chin, my left cheek, my right cheek, my bicep, my other bicep, right side, my leg, right side, my left leg.
Okay. And now I'm going to assess the motor function. So what I did notice when you came into the office that your gait was coordinated. I'm going to have you stand up. Okay, so now we're going to test your coordination. So what I'm going to have you do is stand with your feet together and close your eyes, and we're just going to stand for 20 minutes. Okay, you can sit back down for me. So the minimal swaying was appropriate, so I would say that was a negative Romberg test, which is a normal finding. Now we're going to move on to testing the rapid alternating movements. So I'm going to have you just set your hands on your legs, and you're just going to flip over and over for 10 seconds, okay? 2. Okay, and so I would note that there was equal turning and a rhythmic pace, as well as quick coordination during that assessment. So now we're going to move on, and I'm going to assess your cranial nerves. We're going to start with cranial nerve 1, which is done to assess a sense of smell. So I'm going to just have you smell this and just tell me what the smell is.
Lemon juice.
Yes. Okay, so then we're going to move on to cranial nerve 2, which assesses visual acuity. So I'm going to have you cover your left eye. And I just want you to read my name badge here.
Mackenzie Cooley.
Okay, and then cover your other eye and read the other half of my name badge here.
Chamberlain College of Nursing.
Great. Okay, so now we're going to assess cranial nerves 3, 4, and 6 together. These are done to test your eye movement as well as pupil constriction and dilation. So I'm going to shine this light in your eyes one more time here. Just look right at my nose. Okay, and now I'm going to have you follow this light where it goes, okay, and right back to the middle, all right? Okay, so pupils are equal, round, reactive to light, and accommodating, and when assessing the 6 points of gaze, I did not see any nystagmus. Okay, so now we're going to move on to cranial nerve 5, which is done to assess sensory of the skin as well as the motor nerve in the muscles of the face. So I'm going to have you close your eyes, and I'm just going to touch this, and I want you to tell me where it is located on your face.
Forehead. My nose. On my cheek. My chin. My right cheek.
Okay. Good. Now we're going to move on to cranial nerve 7, which is used to assess the facial expression. So I'm going to have you smile, okay, and raise your eyebrows and puff out your cheeks. Good. Okay, so everything was symmetrical when you did it. Now, for cranial nerve 8, we're going to assess your hearing. So I'm going to have you cover your right ear, and I'm going to whisper some words, and I just want you to say them out loud.
ABC.
Okay, and cover your left ear. I do the same thing on this side.
1, 2, 3.
Okay. Now we're going to assess cranial nerves 9 and 10 together as well. These are done to assess the taste, gag, and swallow reflex. So I'm going to have you stick out your tongue and say ah.
Ah.
Okay, so the uvula rises and falls midline, so we're going to say that the gag reflex is present as well as the swallow reflex is intact. Next, we're going to assess cranial nerve 11. This is done to assess movement of the head and shoulders. So I'm going to have you shrug while I push down. Good. And then we have you turn your head to the left and to the right. Okay. And last, we're going to assess cranial nerve 12, which assesses the position of the tongue as well as your speech. So I'm going to have you stick your tongue out. Okay, so tongue protrudes midline, and I'm going to have you say light, tight, dynamite.
Light, tight, dynamite.
Okay, so speech is clear and articulate. So after the cranial nerve assessment, I would just note that cranial nerves 1 through 12 are intact. Okay. So as we finish up, I'm just going to reassess your pain on the scale of 1 to 10, 0 being no pain. Are you feeling any pain?
No, 0.
Okay. And do you need to use the restroom? Are you comfortable?
I'm comfortable. I don't need to use the restroom.
Okay. So then I would make sure that the call light is in reach. Is there anything else I can do for you?
No, thank you.
Okay, well, thank you for your time. Okay,
Thank you.
and I'll close the door for privacy after I leave, okay?
Thank you.
Okay.